Hi, everybody. Welcome back to episode 4 of the Data Source series, a series where we discuss a series of data sources, all of which are free to use. Today, we're going to be talking about SDOH data, Social Determinants of Health. If you enjoy the video, find it useful, make sure to give it a like and share it with a friend. Comment down below if you have any questions, and enjoy the video.
Hello. Hi, everybody.
Morning.
Good morning. Good morning, JP.
Morning, Shanmugam. Shanmugam, today I think I want to talk about SDOH, Social Determinant of Health.
Right.
And it's very, very interesting when you can get all those details on the patient that you can add. So you can do better targeting of the patient. You can do better targeting of the physician. And we always joke about it. It's like the patient would be like the fish and the physician is like the fish tank, right? So basically you get what's going on, the ecology of the physician.
Exactly.
And so one of the kind of major decision we have to make is which one to buy, and they are not cheap, right? I mean, but the question is there a way for us to get something for free on the SDOH side?
Yes.
And we are also a little reasonable as well.
Right.
So meaning that I'm ready to give up on the resolution of the individual. So, right, if we have some SDOH data that's not specific to one patient, but maybe to some geography, maybe like a zip code, I can even go to the county. I think the state would be too big, right?
Yeah.
But if we can
More
get county, we're
granular.
at 3,100 and something counties in the country. That won't be too bad.
Yeah.
Do you happen to know of any SDOH databases at maybe zip county census tract level? Do you think there are some of them there?
Absolutely. Yeah. We've actually found a couple of dozen data sets of SDOH and then narrowed down to the most important ones, JP.
And how many do you think we should be looking at?
For today, I can show you the top 5.
Oh, wow.
Yes.
Let's
dive
look at
in.
them.
Okay. So these are the top 5 that we picked for today, JP.
Okay, the SDOH data sources.
Exactly.
Okay,
Yes.
good.
So we took one from at the census tract level, which is American Community Survey.
Yep.
Okay.
Yep.
And then 2 at the county level, and these both are very, very powerful by themselves. So one is the County Health Rankings and Roadmaps, CCHR. That is this guy. And then there's a places data set. So it used to be called 500 something, but then they revamped it to an upgrade called places. And then we have the social vulnerability index at the county level. And then we have the EPH, which is the environment public health, where we have like the smoke,
amount of radon,
radon.
UV.
Right.
Okay.
Exactly.
Cool.
Right. So this is really big as well. So yeah, we can go one at a time. So we'll take a stab at the county health ranking.
This one is CHRR.
Yes.
Okay.
Right. And it comes from the University of Wisconsin Population Health Institute. It has totally 84 variables, and these are all
84.
Right. Pretty big.
Wow.
Yeah. And it spans across health factors and health outcomes.
Okay.
And at the county level, across gleaning in from 21 data sources.
So basically, we're getting, for a county, we get different variables to characterize the county.
Exactly.
And we have 3,144 something counties in the country.
Yep.
Right.
Exactly.
Okay.
All of them have identification factor too. And that's how they split by health behaviors, clinical care, like how are they having access to care, uninsured population, education, employment, even the socioeconomic factors, and the quality of air and water as well.
So we can look potentially at one county where we're doing, or several counties where we're doing very well.
Right.
And then other counties that we're not doing so well.
Right.
And see which ones are kind of similar, right? Like a lookalike model.
Exactly.
To project out which counties we should be going after that maybe we're not taking good care of.
Right. We can connect this to what are the factors that relate to prostate cancer, right? So we have that pool of data, and we can go granular as well, right? This is one of them. And this is the sample data for that. So we put Cook County. Our office is based out of Cook, so we took one of them. And
Cook County is the biggest county in Illinois.
yes,
Yes.
right, exactly. So it shows the value and also a lot of variables: premature death, adult smoking,
They're
obesity.
very detailed, right?
Right, yeah.
Wow.
Uninsured teen birth, right?
Yeah. Wonderful.
Mammography screening.
Wow.
So this is good. And this is the places data set.
Oh, so we're done with CHRR now.
Yeah.
Okay.
We're moving to the next one.
So we can, and all of them, they're free.
Yeah.
Right.
Yeah.
So places, it's because you like it because it shows a different thing that we don't get in CHRR.
So places, the geographical unit is more like Chicago, right?
Okay.
They don't go like county or zip. It's more
Okay.
like the Twin Cities in Minneapolis,
Okay,
right? So
okay.
they go
More
like
city based as
yeah,
opposed to county based.
exactly.
Okay.
Yeah. So
I can understand. Yeah.
right, and this comes from CDC as well,
Mhm.
and it's also a different. It's county, census tract, and zip code level.
Mhm.
That city based was the 500 cities.
Mhm.
Now they pulled it back and then renamed it as places, and that can go at the different geographical
So this one you can
unit
go
too.
down at the zip code, right?
Yeah,
And
yeah.
more detail than the CHRR.
Yes.
Uh-huh.
So exactly right. I wrongly said that it goes at the city, but I was referring to the older version. But this one is at the 3 levels, and it goes deeper than the county, which is the census tract and zip code, right? And we have
And the focus will be
disability.
a little different too, right? Because here I can see disability,
Correct.
I can see prevention,
Yes.
health outcomes, and health risk.
Right. And if you can see the health outcomes, you can specifically focus on CKD
Okay.
or
High
stroke.
cholesterol, diabetes. Yeah, that's
Yeah.
very, very relevant, right?
Exactly.
Yeah.
And for cancer, there's
Yeah.
also, except skin cancer, they track that too.
Yeah.
Right. And then this is like a data sample that we have, and what is the how is
COPD? We can track COPD. You can track diabetes and
Exactly.
obesity. Cool.
Yeah. Right.
Mhm.
So, and we took it for 60076, which is for Skokie, our office. And this is the EPH, which is
So we're done now with places.
correct. Yeah.
So we got CHRR, and then we got places.
Yes.
Can go kind of more granular than the
Right.
county.
Yeah.
Right.
So now we're looking at environmental factors, and there are 30 categories, including incidence, prevalence, hospitalization variables, right? And it goes to the census tract level too, right?
So you got climate stuff, right? Where kind of UV,
Yeah.
and you got all those environmental factors, right?
Right. Like drinking water, and then
Okay.
childhood cancer, lead poisoning, and then hormone disorders,
Yeah.
right? And reproductive or birth outcomes, radon, like you were mentioning earlier. So
And then this one, the granularity is at the county level as well. The county can go to the zip.
yeah, zip
Yeah,
code,
yeah.
census tract, county, biggest state, right?
So the idea is you could group all that stuff, right?
Right. Yeah.
And they're all free. You kind
Right.
of put them together, and then you get even a lot of variables.
Right. Yeah. For each county, we can create
or even zip, right?
couple of
Yeah.
100 variables.
Yeah, wow.
Easily. Right.
Mhm.
So this is a map. I know they have a
Oh,
visual,
cool map. Yeah.
right? And they kind of put it in a way where we can visually select.
So that's a tool that you can go on the web, and then you basically ask what you want to look at, right?
Right.
Uh-huh.
It comes from CDC, and they have a
So
portal
here
for
you
that
ask
too.
for the state, but you could go and ask for the zip code or
Right.
whatever stuff.
Yeah.
And you can download the data, right?
Yes.
Cool.
Yeah. If you see here, there's a download option there, and these are the metrics that I selected. You can select the timeline, right?
Yeah.
The year and the variable of
Wonderful.
interest for you.
Okay.
And the last
So
one,
we're done with the EPH.
Correct.
So the EPH gives you the environmental piece that maybe we missed a little bit in the
Right.
other two.
Yeah.
Okay.
And this one is the
SVI.
social vulnerability index, and it talks about the demographic and socioeconomic factors like the access to healthcare or transportation. Is it like crowded housing, right? And it uses 16 variables coming directly from ACS, and which is used to identify communities, and these are the big buckets.
So you can see it as an enhancement
right.
of the U.S. Census, right? Kind of
Right.
focusing more on the vulnerability of people.
Right. And this is a great way to kind of measure access to care,
Yeah.
and their household situation, right? Their education,
Yeah.
right? And this is actually how they measure it. And by each county, we have a FIPS attached to it.
Yeah.
and the area to gauge how, and also the
profile,
population.
yeah.
Right. And for us, we just focused on civilian with a disability, and these are the count.
Yeah.
For that. And
and you can focus on anyone that you want.
Exactly. Yeah.
We're looking at the US Census now, right?
Right. So this is the fifth gem that we talked about, and this is actually the most detailed socioeconomic data set, and it has housing as well. And if you see the level of granularity that they can go, it goes beyond the census tract.
Beyond the zip code, you can go below the zip code.
Right. Census tract is already below the zip code.
And then you have the block group and the block.
Yeah.
Maybe not for all the variables though, right? For maybe certain variables.
Yeah.
Right?
They have like 56 variables, but for most of them, we could go deep. Right.
Yeah, that's good.
And they split across 4 different groups: social, economic, demographic, and housing. And I can give you an example of the 56 variables, 56 actual tables that they have.
Yeah.
And
that's a lot of variables.
Right. You can see population metrics, the Hispanic or Latino.
Yeah. So ethnicity, we get good ethnicity data here.
Ethnicity, right? And then household language.
Yeah, that's kind of correlated with ethnicity, I think.
Right. Yeah. Types of diabetes, and then veteran status, housing tenure, and then mortgage status. And for us, I thought we could look at the private health insurance status. And out of the 56 variables. So yeah, this is what we found.
So you have a breakdown by male, female, and stuff, right?
Yeah. By age
insurance,
group. Right. They have like under 6 to 18, and then it goes like 15 year blocks.
And that's for one county, Baldwin County in Alabama. Right.
Exactly. Yeah.
That's
and then people with private insurance, people without, male, female, right? Yeah.
So that's a wonderful profiling of the patients and the physicians that operate within a county or zip code or census tract, whatever you want to choose.
Yep.
Okay. So basically, what we've seen here is that we've got 5 in your selection, 5 very interesting SDOH data sources that kind of have a little different focus depending on what we're looking at, and we can put all them together, say at the county level, and we get a very rich picture from different perspectives of what's going on. And all that's free, right, Shamagam?
Exactly. Yeah.
Why? So why are we not using those? You know?
Yeah, people don't know, might know ACS, but I think we went through deep and kind of figured it out and cataloged all of them and what variables they have.
Or maybe people believe that, if you use SDOH, you have to have it absolutely at the individual patient level.
Yep.
Which, if you have the money to do it, that's great. But if you're exploring, and also I think there are many insights you could get without needing to go exactly at the individual level, right?
Exactly. Yeah.
For many of them, I think this one works fine.
Right. If you could be more specific at the geography level, these are excellent, right?
Yeah.
And,
I'm with you. 100% with you.
Exactly. Yeah.
Thank you, Shanmugam.
Yeah.
Bye.
Bye-bye.